Several years ago, we hired a benefits coordinator to help manage patients as they enter the system. The number one reason why we did this was because physicians do not like to talk about finances with patients in the room.
Most people don't feel comfortable sharing with a physician that they may not be able to afford their care. They may not be able to afford their oral medications that are being prescribed. It's very important that I take the burden of the financial part away from the doctors so that they can focus on the care of our patients.
The second reason we hired a benefits coordinator is because most pharmaceutical companies' assistance programs, you have to have the patient signed up prior to treatment to get any benefit. And if you do not have them signed up prior to treatment, there's no recourse.
I look at foundations, I look at assistance programs, copay cards. Pharmaceutical companies offer great benefits for these patients so that they're able to afford their care.
The third reason why we hired a benefits coordinator is because if we have to set up a payment plan with the patient, it's best to be done prior to treatment.
Part of my job as a benefits coordinator is to make sure that all of the information has been gathered prior to their arrival, that the insurance papers are there, that all of it is correct, that we've verified insurance to making sure that it's current. We become very aware of whether there's prior auths that are going to be needed for particular drugs. We also examine to make sure that all the medical records from all of the physicians are in place so that there's no delay in the care of our patients.
I think a big misconception out there is that many patients don't want to talk about finances. What we found out over our last several years is it's something that's weighing heavily on their mind.
After a patient and I have discussed what's weighing so heavily on their hearts and in their family lives, most often I do get a hug.